Are you interested in birth control, but want to know your options beside the pill? Maybe you struggle with heavy cycles and you want to know what are the options. Well, the IUD may be for you. So stay tuned as we talk about what the IUD is and what it's like to get it inserted. Welcome back to my channel. I'm Dr. Renita White, a board certified OBGYN and women's health expert. And this channel is all about you, your body, and how to take care of it. So at this channel, we talk about everything from periods to discharge, what to expect at the doctor's office, and figuring out the best way to advocate for you and your health. So if you love this kind of content, please comment below, like, and don't forget to subscribe and hit the bell so you stay up to date with each episode released every Friday. So let's get into it. IUDs, intrauterine device. It's a type of birth control that honestly is rivaling the pill when it comes to what's happening in my office these days. So let's talk about it. The intrauterine device, or IUD, is a type of birth control that sits on the inside of your uterus, not the vagina, the uterus. There are two types, one with the hormone and one without. The major gist is that it can work over the course of years to prevent an unplanned pregnancy, and depending on what type you use, to address other issues like painful cycles or heavy bleeding. So let's get into the details. So there are two classes of IUDs, a non-hormonal IUD, like the Paragard IUD, and the hormonal IUD. Those include Skyla, Kyleena, Liletta, and Mirena. So what exactly do these do and how do they work? Well, the main function of these are to prevent unplanned pregnancies. When you're looking for something that's effective, these are top notch because one, it takes the guessing out of it, the work that you have to do on your end. When an IUD is placed, you don't have to do a thing. Over the course of 5 to 8 to 10 years, depending on whichever one you pick, it can prevent that unplanned pregnancy. Now, the basics are pretty similar for both of them. They look the same, they are inserted exactly the same way, and the job of preventing an unplanned pregnancy is identical. These options are just as effective as tying your tubes. So it's not permanent. You can change your mind, take it out whenever you're ready, but once it's in there, you have the lowest chance of having an unplanned pregnancy. So how do they work? Let's talk first about the non-hormonal IUD. The Paragard IUD is the brand name for the non-hormonal IUD, also called a copper IUD. And it's called that because it has a little tiny amount of copper that's within the body of that IUD, and that's what's doing the job to prevent an unplanned pregnancy. So there's not exact science on what happens to make this work, but what we think goes on is that little bit of copper changes the environment of the vaginal discharge, the cervical mucus, and the environment of the uterus so that it's not the best environment for sperm to move around to get to the egg or for a fertilized egg to be implanted. This form of IUD can even be used as a type of emergency contraceptive. Now, because it has no hormone, once it's in, you'll still have whatever's normal for you with your period. So the timing should be the same when you have that period with the copper IUD. Now let's talk about the hormonal IUD. As I said, there are 4 different types. The basics about them is that they have different amounts of progesterone that are slowly released over the course of years. Skyla is a type of IUD that has the least amount of that progesterone and can only last for 3 years. Whereas the Mirena and Liletta, basically the same IUD, just different brands, they're releasing a larger amount of progesterone, still small, but larger than Skyla, over the course of up to 8 years. Now, anytime you have an IUD with a little bit of hormone, you may see a change in your period. It's very normal to maybe not have a cycle at all, to have light spotting occasionally, or maybe in place of your period. Or for those who have a regular cycle each month, it may just look a lot lighter, less noticeable each month. So, how long can these last? As I said, these can last for years. It is safe for it to stay in for as long as it has been approved for. And interestingly, for those who have had IUDs placed recently, the FDA has changed some of the guidelines on how long they can last for. So IUDs like Liletta and Mirena years ago could only stay in for 5 years, but now are approved for up to 8 years. You may be wondering why that's the case. Well, we know that these IUDs are able to prevent an unplanned pregnancy for many years, but studies always have to be done to prove that that's still safe and okay. So these studies are always ongoing, and I would not be surprised if they expanded it beyond 8 years in the next few years. So let's get into what it's like to get an IUD placed, because I hear this all the time. Is it gonna hurt? I've heard horror stories. I was told I'm not supposed to get an IUD if I've never had kids before. So let's get into it. So first of all, IUD insertion can be nerve-wracking. I've had 3, and before kids and after, I even still was nervous a little bit myself. With placement, it should feel like strong menstrual cramps. Everyone's got different pain tolerances, but it can feel a little bit uncomfortable. So we'll talk today about things to help make it more comfortable. So when you've decided that you want an IUD, know that you don't have to have babies before. You do not need to have birthed a child, whether by vaginal delivery or C-section. This is for anybody. When you are ready for that appointment, your doctor may recommend that you take a medicine the night before to help things be a little bit more smooth with placement of the IUD. So there is a medicine called misoprostol, which is a small pill that looks about the size of a Tic Tac, and it helps to dilate the cervix just a little bit more to make things comfortable for placement. This is by no means a requirement, but it's something that you can talk to your doctor about to see if you'd be a good candidate to take the night before. Another thing that you can do before your IUD placement is to take ibuprofen or some kind of NSAID before that visit. Taking this medicine at least 30 minutes in advance can make it more comfortable for you when that IUD is placed. So on the day of your appointment, your doctor may ask you to leave a urine sample to do a pregnancy test to make sure that there's no unexpected pregnancy before this IUD is placed. One of the best things that you can do before your IUD is placed is to avoid sex or use condoms or some type of protection the week leading up to that IUD placement. Once it's time to do the procedure, you'll get undressed from the waist down and lay on the table with your legs in the stirrups. For those who get pap smears, it's very similar to that experience of getting your annual pap smear. When your legs are in the stirrups, your doctor will use their fingertips to feel the contours of the uterus. This allows us to know what direction is your uterus. Does it lean forward or to the back? And this is really important for placement of that IUD. Next, something called a speculum is inserted into the vagina so that we can see the cervix, that bottom part of the uterus. This will be in a little bit longer than your pap smear because there's a little bit more to it when we place the IUD, but it shouldn't be longer than about 2 to 3 minutes. Once that speculum is in place and the cervix is well visualized, your doctor may add a little bit of a numbing solution to the outer part of the cervix and will also add a cleaning solution to the cervix. This is used with a cotton swab, so just may feel like a little touching or a little bit of movement. This should not hurt during this part. Next, your doctor will use this instrument called a tenaculum to place a little bit of traction on the uterus to straighten it out. This can sometimes feel a little bit like a pinch, and so sometimes your doctor may try to distract you with a cough or talking during this part, but it just takes a brief second for that little pinch. The next part of the IUD placement is measuring how long your uterus is. This is done with something called a uterine sound. This uterine sound goes into the uterus by going through the cervix all the way to the top of the uterus. Sometimes your doctor may push in a little bit of a numbing medicine called lidocaine just to help make the procedure more comfortable during this portion. This can feel a little bit like cramping or a little bit of some lower abdominal discomfort, but it should only last a few seconds. Once the uterus is sounded, that's when the IUD device can be deployed into the uterus. The IUD comes in a kit that's already preloaded with the IUD, and so your doctor can set the length of your uterus and insert the IUD to the right spot. This usually takes about 10 to 15 seconds, and this is when you'll have 10 to 15 seconds of cramping that can be intense, but should be short-lived. Once the IUD is in, your doctor will cut the strings and remove all those instruments from the vagina. It's normal to have a little bit of some spotting or light bleeding afterward, It's possible that a period may start soon after if you were already due for your cycle. And then usually after the IUD is placed, you're good to go home. If you feel like you might be too crampy or uncomfortable, maybe make sure that you have a ride to help you home. But for most people, you should be able to do all your normal activities after the IUD is placed. So you can go back to work, go to the pool, do anything that you normally want to do. If you were already on a type of birth control or protection prior to the IUD placement, then you should be covered when it comes to an unplanned pregnancy. But don't forget to use condoms to prevent against STDs. If you were not on any type of birth control before and you're worried about an unplanned pregnancy, make sure to still use a condom that first week before to make sure that you don't have an unplanned pregnancy. Now that is the gist of an IUD placement. I promise you it is not as scary as it seems. So what might you expect after the IUD insertion? Well, as I said, you might get a little bit of cramping that's mild afterwards, so you can continue to use ibuprofen or something after the fact when you head home. Light spotting or bleeding can be normal for the first few days as well. Now, whether you have the copper IUD or one of the hormonal IUDs, it is possible that you may have a couple weeks of irregular bleeding until your body gets adjusted. However, if you are bleeding and requiring more than 1 pad an hour, heavier than your cycle, or you're having severe pain that over-the-counter medicine is not helping, notify your doctor right away. So one of the great things about the IUD is that it helps with lots of other things besides just preventing an unplanned pregnancy. For example, let's say you have super heavy cycles. Well, the levonorgestrel IUD, such as the Liletta and Mirena IUD, are approved to help maintain lighter cycles for those who have heavier bleeding. For some, they may not have a cycle at all. Another thing that IUDs can help with are women who have super painful cycles. So by decreasing how heavy your bleeding is, it can quiet the uterus enough that you may not have to deal with such pain. Even for women who might have endometriosis, adenomyosis, or other issues that can lead to pain. Sometimes people have symptoms related to fibroids, like heavy bleeding from fibroids, and aren't ready or aren't necessarily candidates to undergo a surgery. Well, the hormonal IUD can really be helpful to decrease these fibroid symptoms like pain and bleeding. Another great reason people use the IUD are for women who have irregular bleeding due to things like PCOS. We always talk a lot about protecting the lining if you're not having a regular bleed, but protecting the lining means preventing it from overgrowing and growing too much. So women who have PCOS may choose to be on the IUD just to keep their lining of their uterus nice and thin. So there can be many reasons that an IUD could be for you, and if you're interested, talk to your doctor. And before I forget, what to expect with IUD removal. So, as I mentioned, IUDs have those little strings that hang out the outside of the cervix just for them to be removed. So when you're ready for your IUD to be removed, your doctor can place that speculum into the vagina again so that we can see the cervix, and then they use an instrument to grab those strings and just pull them out. So super easy, a lot faster than getting it placed. But at the end of the day, the beauty about the IUD is that if it's for you, you can use it for many years. If it's not, just take it out and try something else. I hope this information was helpful for you today to learn all about the IUD and help calm your nerves before an IUD placement. So if you like this information, definitely like, subscribe, and hit the bell. If there's other things that you're interested in hearing about, let me know. Comment below or send me an email at hello@renitawhitemd.com.